Hello, I'm Doug Edwards, Director of the Psychiatry and Behavioral Health Learning Network. And today I'm joined by Dr. Lynn Marie Morski, President of the Psychedelic Medicine Association. Dr. Morski is a Mayo Clinic trained physician, attorney, and former adjunct law professor, and is on the steering committee of the SANA Symposium. Dr. Morski, thank you for joining us. I'm delighted you can spend a few minutes with us today.
Thanks so much for having me, Doug. Really appreciate it.
You're welcome. So let's talk about, tell us, what is the Psychedelic Medicine Association?
The Psychedelic Medicine Association is a group whose mission is to educate frontline healthcare providers on currently available and soon to be upcoming psychedelic therapies. Because as these therapies become available, there's no way that they're going to get to patients unless those frontline providers know that they exist and feel comfortable discussing them with their patients. And so that's the role we're filling.
And what kind of members do you have in the PMA right now?
The PMA has members all the way from students who are new to the healthcare field through those in residency and fellowship. And then we've got providers from social workers to psychiatrists, counselors, primary care physicians. We've got some cardiologists and anesthesiologists in there too. But anybody who's frontline on when some patient comes forward and says, I'm having this issue, we want them to feel welcome to come into the Psychedelic Medicine Association and learn to have a more broad conversation about the therapy options for those patients.
Yeah, I think this is very timely in the sense that we at the Learning Network did a survey in January of our broad reach, and we discovered that half of our respondents said that patients were starting to ask about psychedelics. So it's so useful that you're starting to bring this education to the frontline people who ultimately are getting these patient requests for more information.
Yeah, we're happy that that many patients are asking. And then we're also thinking about the patients who don't know. We want the doctors and the frontline providers to say, hey, look, there are these new options out here for something that you may have already tried some therapies and they may not work. Psychedelics may provide a whole nother avenue for them.
So what are your goals in terms of educating clinicians and other stakeholders? Well, what's PMA trying to accomplish here?
We're trying to make sure that, like I said, whenever a patient goes to their clinician and says, I'm having this problem, maybe it's anxiety, depression, or as we're getting into even more physical health problems, we want their provider to say, look, here's the options, here's the traditional options that you might have heard of, but now we have this other range of options. And we want to have them feel comfortable having that discussion with the patients about the psychedelic therapies that are out there, so that not only the physicians feel more comfortable, but the patients are getting a much broader range of options for things that have been really difficult to treat in the past.
Mm-hmm. Yes, I think we're going to be hearing more and more over time about, there's so much research going on that the next 5-10 years, there's going to be an explosion of diagnoses in which psychedelics may be useful. You know, the PMA has decided that the SANA Symposium is its official meeting. And I'm curious, what can PMA members and others, what can they learn from the SANA Symposium? What are you looking forward to at the conference?
Well, I'm looking forward to obviously learning the latest in psychedelic science. But as you said, I'm looking forward to hearing all the new avenues of research into things like dementia and OCD. And like I said, more physical things. We're hearing about cluster headaches, et cetera, things that have been really hard to treat in the past. And so I'm looking forward, and I know that the other PMA members are looking forward to learning that kind of thing. But I also feel as though psychiatrists and therapists are going to come away with a lot of hope, because so many therapies that we have right now are just not that effective. And it's been really frustrating, I'm sure, to treat patients who've come to, you know, they come up with things and they are eventually labeled treatment resistant. Mm-hmm. And psychedelics can help a lot of those conditions. And so hopefully those providers and therefore their patients are going to have a lot more hope after this symposium.
Great. Yeah, I'm looking forward to it in September. And Dr. Morski, if someone wants to join PMA or learn more about the association, where should they go to online?
You can head over to psychedelicmedicineassociation.org. We have individual members, like I said, clinicians from students all the way up through those who are practicing. And then to help us in our education mission, but also in our patient access mission, we've got all other kinds of organizations from the psychedelic world that are responsible for research or legislation. And so those kinds of organizations can head over to psychedelicmedicineassociation.org as well and join.
Excellent. Well, thank you, Dr. Morski. And ladies and gentlemen, as we were discussing, I hope you can join Dr. Morski and myself to learn more about the latest in psychedelic research and treatment strategies for mental health and addiction professionals at the inaugural SANA Symposium. And it's a virtual event taking place September 17th through the 18th from the same team that brings you Psych Congress, the Evolution of Psychotherapy, and the National Conferences on Addiction Disorders. Be sure to visit sanasymposium.com to learn more and to register.